Hi, I'm Janet Jenkins. I'm a physical therapist assistant at the Outpatient Therapy Services here at Phelps Health. I am going to talk with you today about some generalized stretching for injury prevention, just daily stretches that are really good for you and for your body and allows you to move freely. So the first thing I'm going to start with is a stretch in the front of your chest muscles here. A lot of times we do a lot of work out in front of us with computers, with driving, sitting in reclined positions. Our shoulders roll forward, and so we want to stretch these out so that we can allow our posture to improve and everything to function better. So the first stretch I'm going to show you can do in the doorway of your home, and you're going to put your arms up at 90 degrees in this position, and you're just going to gently step one foot forward, and you're going to just slightly lunge forward, and you're only going to go till you feel a very gentle stretch, and you're going to hold this for 30 seconds. And what you do is just count out loud, watch a clock, anything you can, because muscles like stretch. So again, no pain, just a gentle stretch. And once you're done with that, you step back to your starting position, let them relax out, and then you take your opposite foot and step forward. And you're going to hold that again for 30 seconds. This again should just be a comfortable stretch in the front of your chest muscles, right here in the wall. And you're going to do that 2 times with each foot leading, holding for 30 seconds. The next one, you're going to lower your arms down a little bit, so you look like you're a W. And you're going to again step one foot forward, kind of lunge gently in till you feel a slow, gentle stretch. And hold it for 30 seconds. Again, stretch is important to feel good, not painful, and our muscles like stretch. Good. And then you come back, and again, step with the opposite foot, lunge slowly in, hold for 30 seconds, and then relax out. This is a good stretch for those pectoral muscles and your chest wall. So the next exercise I'm going to show you is another thing for our posture, and it's shoulder blade squeezes. So you turn around and you just pinch your shoulder blades back and then relax. Hold them for a couple seconds each time. You can see straight back. I'm not lifting my shoulders. I'm just leaving them down and relaxed, pinching those shoulder blades back, holding for a few seconds, and then relaxing. This again opens our chest wall and strengthens those muscles in our shoulder blades to help our posture. Some next exercises are going to be for your neck mobility. So what I'm going to have you do is you just stand, shoulders relaxed, posture upright, and you're going to turn your neck side to side, like if you were shaking your head no. You're going to look over each shoulder until you feel a gentle stretch or till it just wants to stop. Don't force the motion. Keep everything nice and relaxed as you move. So you're just going to move your neck looking over your shoulder 10 times, and that's plenty to keep it nice and low. The next exercise is going to be looking up. I like to pretend I have like a softball behind my neck that I'm going to look up and over to the ceiling and back down to the floor. This allows that neck to come back all the way up without any pinching. You don't want any pinching and you don't want any hard pulling. 10 times. And the next exercise is side bending. So this stretches out the sides of your neck, and you just go side, ear to shoulder, ear to shoulder. Remember, 10 times. None of these should hurt. They should all feel good, gentle stretches, and don't force the motion. Shoulders stay relaxed. Sometimes we have tightness in our shoulders up into our neck, and this stretch is a good one to help relieve some of that. So you literally put your hand on your head and gently stretch over, just enough overpressure that you feel a good stretch. If that's not enough, you can take your arm and put it behind your back, and you feel a little bit more of a stretch. You should feel this right through here on your neck. Okay? Again, 20 to 30 seconds. Hold on this, and then you relax. Come back to the other side. Gently press over to the other side. And this again should feel good. No forcing the motion. All right, we're going to move on to stretching our shoulders. One stretch you can do is behind your back. I'm going to turn around and show you. You put your arm behind your back and you do this with the other hand. Sometimes we have a hard time tucking our shirts in. We can have a hard time with putting a belt on, and this will help increase that motion. So again, you put your arm behind your back, reach with the other arm, and then you just pull in. And you kind of get a little stretch in the front of your shoulder here with this. Don't increase any pain, just gentle stretch. And you can do that with your other arm as well. Then we're gonna move on. We have a hard time with lifting over our heads. Getting those arms up, they feel tight. We may have had an injury, we may have slept wrong on it, or we just may be feeling tight in those shoulders and we wanna get more motion. So you can use your wall at home to help you get that range. So what you would do is take your hands, put them on the wall like this, and you just slide and let that wall help you. And you kind of step into it a little bit. It'll give you more of a stretch up and then back down. And you just slide those arms up, let the wall assist you as you lean in and back down. Average reps of these is about 15. Go to your tolerance with it. Don't increase your pain. Again, then we're gonna go sideways. So you're gonna put your arm like this on the side. You're gonna slide it up, and if you have to go farther, you can step into the wall and back down. So again, 15 is the average reps of these. You can do fewer if it's uncomfortable or you're tired. You can do more if it feels good. Just go to your tolerance. Thank you for watching these stretches with me today, and I hope they help you increase your mobility and get back out there to doing the things that you love. If for some reason you have experienced pain or you have some issues that may concern you a little further, please reach out to your primary care physician. If the two of you decide that it's appropriate for you, then they can send you a referral to receive some outpatient therapy services, and we can help you get back to doing those activities that you enjoy the most.